T2 stir coronal. Plan the coronal slices on the axial plane and angle the positioning block parallel to the right and left hip joints. Check the positioning block in the other two planes. Ensure an appropriate angle is given in the sagittal plane, i.e., parallel to the femoral shaft. The slices must be sufficient to cover the entire thigh from anterior to posterior. The FOV must be large enough to cover the entire thigh from the hip joints down to the knee joints.
T2 TSE sagittal. Plan the sagittal slices on the coronal plane. Angle the positioning block parallel to the femoral shaft. Check the positioning block in the other two planes. An appropriate angle must be given in the axial plane, vertically across the right thigh. Slices must be sufficient to cover the right thigh from medial to the lateral aspect.
T2 stir axial. Plan the axial slices on the coronal plane and angle the positioning block parallel to the right and left hip joints. Check the positioning block in the other two planes. An appropriate angle must be given in the sagittal plane, perpendicular to the femoral shaft. The slices must be sufficient to cover the entire thigh from the hip joints down to the knee joints. In the case of localized pathology, focus the axial block solely on that specific area.
Indications for MRI thigh scan. Marrow abnormalities, avascular necrosis, marrow edema syndromes, and stress fractures. Muscle and tendon disorders, strains, partial and complete tears, tendinitis, and tendinopathy. Congenital and developmental conditions. Neoplasms of bone, joint, or soft tissue. Infections of bone, joint, or soft tissue. Myositis and osteomyelitis. Hamstring injury. Ligament tears. Acute trauma. Fractures. Abscess. Ulcer. Contraindications. Any electrically, magnetically, or mechanically activated implant, for example, cardiac pacemaker, insulin pump biostimulator, neurostimulator, cochlear implant, and hearing aids. Intracranial aneurysm clips, unless made of titanium. Pregnancy. Risk versus benefit ratio to be assessed. Ferromagnetic surgical clips or staples. Metallic foreign body in the eye. Metal shrapnel or bullet. Patient preparation. A satisfactory written consent form must be taken from the patient before entering the scanner room. Ask the patient to remove all metal object, including keys, coins, wallet, any cards with magnetic strips, jewelry, hearing aid, and hairpins. If possible, offer someone in the scanner room for claustrophobic patient, for example, relative or staff. Offer earplug or headphones, possibly with music, for extra comfort. Properly explain the procedure to the patient. Instruct the patient to keep still. Note the weight of the patient. Positioning for MRI upper legs. Position the patient in supine position with feet pointing towards the magnet, feet first supine. Position the patient over the spine coil and place the body coils over the thighs. Anterior superior iliac spine down to knee joints. Securely tighten the body coil using straps. Center the laser beam localizer over the mid-thigh.